Hey everyone, Ryan here, and welcome to the practice questions video for the Operative Dentistry series. So this is everything that we went over in our Operative Dentistry series, and if you haven't already, I definitely encourage you to watch those 6 videos in the series before attempting these questions. I covered the highest yield information out there so that you can confidently crush your exam. So in this video, I compiled 15 questions for us to go through together to test what you learned. And these will be very similar to the kinds of questions that you see on test day. So let's get to it. All right, question number 1. According to G.V. Black, the outline form of a cavity preparation is the shape of the cavity preparation, and complete this sentence. So go ahead, pause the video, think through the question, and then we'll go over it together. So one of the best test-taking strategies out there is to eliminate the wrong answer choices. So let's do that. G.V. Black's steps to cavity preparation start with the outline form, followed by the resistance form and then the retention form. So if we're looking at answer choice A, we know that the outline form has to be before the resistance form, not after that. So A can't possibly be true. Now B is a very tempting answer choice because you may remember that the outline form is defined by the extent of the carious lesion. So it makes sense that you remove the caries and then you get the outline form. But remember that the initial caries removal is only mesial distal and facial lingual, not depth. The depth of the cavity preparation is taken care of in the final tooth preparation, getting rid of those final deep caries if there are any. So B is not entirely correct. Along the pulpal floor is the internal perimeter, which is close but not entirely true. And that leaves answer choice D. The outline form of the tooth surface is defined as the outer perimeter of the preparation along the cavo-surface margin. So the answer here is D. Question number 2. Triturating a dental amalgam, and complete the sentence once again. So go ahead, pause the video, and then we'll go over this together. Okay, so let's eliminate the wrong answer choices. If we're looking at answer choice A, the size of the alloy particles are not significantly affected by the reaction. So we can rule that one out. Now, if we're looking at answer choice C, it's true that the reaction is irreversible, but mercury is not converted to silver. Both of them are present in the amalgam formulation according to Ames ratio. We have a 1-to-1 ratio between the elemental mercury and the silver alloy. So that one can't be correct either. And then for answer choice D, the problem is the word dissolves, because all of the particles are not dissolved in the mercury, because we actually have several different reaction products, including the gamma phase, which is unreacted silver tin alloy particles that don't contact the mercury at all. So trituration exactly mixes the amalgam components within the capsule where the alloy particles are coated with the mercury on the other side of the capsule. So answer choice B is the most accurate to describing the trituration process. Here we have a look at our amalgam capsules, what they look at on the outside, and this is what they look at on the inside, with the mercury on one side of the capsule, the alloy particle powder on the other, and we have this membrane separating the two, and that membrane breaks once the trituration process starts, and then these two things mixed together. All right, question number 3. Which of the following describes the best way to safely remove carious dentin near the pulp in a class 1 preparation? Go ahead, pause the video, and then we'll go over this together. All right, so we can rule out 1 or 2 of these answer choices right away. And the key here is that we're looking at how to safely remove carious dentin near the pulp. This class 1 preparation part is not really relevant and doesn't affect our answer, but the pulp part certainly does. And I would say that a high-speed burr and an explorer tip especially are actually quite dangerous to be using close to the pulp. A high speed should be used for preparing cavity walls, and the explorer tip is contraindicated entirely because you could actually quite easily pierce the dentin and create a small pulp exposure. So that leaves us with a spoon excavator and a slowly rotating large burr. The spoon excavator is good for removing soft, infected dentin, but you might struggle with affected dentin, which would require firm pressure to remove, and you could again poke through the pulp if you're using that firm pressure. So the safest method is a large, slowly rotating round burr, which has the least chance of accidentally exposing the pulp during deep caries excavation. So the answer here is C. Question number 4. For a dental hand instrument with a formula of 1085-714, the number 10 refers to what? Go ahead, pause the video, and then we'll go over this together. So as you might have seen in our third video, it's really easy to get bogged down in all of the intricacies of the 4-digit formula. But this is really the extent that they'll ask you about it. So if you just memorized width, cutting edge angle, length, blade angle in that order, that's honestly all you need to know for a question like this. So if you know the first number is associated with width, maybe you don't even remember that it's the width of the blade, it just has to do with width of some way. Well, there's only one answer choice here that mentions the word width, and so the answer has to be A. And sometimes it really is just that easy, as long as you remember the right buzzwords. Now, I want to take this opportunity to clarify something that someone in the comments pointed out. From buzzwords alone, we know that A describes the first digit, B describes the second digit, blade length in millimeters is the third digit, and blade angle describes the fourth digit. Now, I had said that the second digit is measured as the primary cutting edge angle relative to the long axis of the blade, which is this dotted line. But that's not the full story. So when these two things are perpendicular, it's true that the second digit is omitted entirely. But the actual number of both the second digit as well as the fourth digit is measured in centigrades, or a percentage of 360 degrees. So for the fourth digit, the blade angle is measured relative to the long axis of the handle, which we'll represent with this line here. So that is our long axis of the instrument handle. And then we can measure between the blade long axis and the handle long axis, and we can get either this angle here or this angle here. It doesn't matter, they're both equal. And that's going to be for our fourth digit. We take whatever that angle is and convert it to a percentage of 360 degrees. And that becomes our fourth digit. So in this case, this angle consumes 14% of a full circle. Now for the second digit, we do something very similar. The cutting edge angle is also measured relative to the long axis of the handle. So we extend that primary cutting edge up like that, and we go clockwise from there until we hit the long axis twice. And whatever that entire angle is converted to a percentage of 360 degrees. So in this case, it's probably something like 85 or 90, and that becomes our second digit. So 85 or 90% of a full circle is consumed by that angle. Now, it's not relevant for this instrument particularly because, again, this cutting edge angle is perpendicular to the long axis of the blade, and that makes us omit this number from the formula entirely. So just wanted to clear that up. All right, question number 5. Each of the following design features of a mesial occlusal amalgam preparation will prevent the restoration from falling out into an adjacent edentulous space except which one? Go ahead and pause the video and then we'll go over this together. So first we have to figure out what a question like this is really asking for. And it's talking about prevention of falling out. And that's just one way to define retention. So let's find all of the things that add to the retention form. So convergent walls, we like that. They certainly provide retention of the restoration from being dislodged. So that's a good one. An amalgam pin provides both resistance and retention. So that's a good one as well. And occlusal dovetails prevent proximal displacement. So that's a good one as well. Beveled pulpal-axial line angle, well, that's a good thing to have. We like rounded internal line angles, but they provide resistance, not retention. So it's not what this answer is looking for. So the exception in this case is going to be answer choice D. Question number 6. Place the following steps in the correct order for the application of a 4th generation bonding system after tooth preparation is complete. Go ahead, pause the video, and then we'll go over this together. All right, so this one is a tough one. It's a long question. There's a lot going on, and I know it can certainly be overwhelming just looking at it. So let's break this one down, and I promise you know everything you need to know for this question. So the 4th generation bonding systems are our gold standard. That's where everything is in its own bottle. So we just need to follow all of the conventional steps. After tooth preparation is complete, we etch the enamel and the dentin for 15 seconds. So that's going to be our first step. We can't just leave the etch there. We need to rinse that off. So we have to rinse that etch off somehow. But remember, we like to leave that surface moist to prevent collagen fibrils from collapsing so that they can receive the primer. So the primer is going to be our next step. And then after that, we place the adhesive. We thin those layers with gentle air, and then we light cure them in place. So the correct order for this sequence is going to be 4, 2, 3, 1, 5. 4, 2, 3, 1, 5. That matches up with answer choice C, and that is our correct answer. Question number 7. What is the photo initiator found in light cure composites? Go ahead, pause the video, and then we'll go over this together. All right, so let's eliminate the wrong answers for this question. Benzoyl peroxide is the initiator, but in self-cure composites, not the photo initiator. So that is a tricky trap answer, but it's not correct. The tertiary amine is the activator in self-cure composites, so that's not correct. Silane is the coupling agent that adheres the filler in the matrix, so that's not what we're looking for. Visible blue light carries out the polymerization reaction for light cure composites, but it's through the initiation of something else, and that's camphor-quinone, which is the photo initiator. And remember, my memory trick for this is that we like to take photos when we go camping outside. So the correct answer for this one is going to be B. Okay, question number 8. Leakage of the margins of an amalgam restoration. And here's another complete the sentence type question. So go ahead, pause the video, and then we'll talk about this one. Okay, so leakage of the margins of a restoration is never a good thing. That's a recipe for disaster, for post-op sensitivity, and for recurrent caries. So let's recall 2 features of amalgam related to that gamma 2 phase, and both of them start with the letter C. That's creep and corrosion. So creep is another name for plastic deformation, and as the amalgam is chewed and functioned on, that amalgam protrudes from the margins of the cavity over time, creating unsupported edges. So this is a bad thing. Corrosion, on the other hand, describes how the material fills and seals the microgap between the tooth and the restoration over time. And this is a good thing. But both creep and corrosion are related to the weak gamma 2 phase found mostly in those low copper amalgams. So you can imagine that corrosion and the percolation of those corrosion products is going to actually prevent leakage at the margins, and this will improve with time. So with that knowledge, let's go through the answer choices. So the ratio of gamma versus gamma 1 phases is certainly on the right track, but gamma 2 is the phase that we're after here. So this is not quite right. So A is not the correct answer. Leakage is high compared to macrofill composites. Well, macrofill composites are actually more likely to experience leakage due to those large filler particles. So the opposite of this is true. And leakage is least at the time of restoration placement. Well, actually, leakage is going to be most at the time of restoration placement, and it decreases as that restoration gets older and corrosion and marginal sealing take place with age. So the opposite is true for that as well. So the correct answer for this question is D. Question number 9. Which one of the following acids is most commonly included in glass ionomer formulations? Go ahead, pause the video, and then we'll go over this one together. So interestingly, as many of these questions will do, all of these acids can show up in dentistry in one way or another. Phosphoric acid is our acid etchant, and that's not what we're looking for in this question. We're looking for what's going to be in glass ionomer. Tartaric and maleic acid can appear in glass ionomers, although they're much more rare, and we're looking for the one that's most common. So those I'm going to confidently rule out from here as well. I'll give you bonus points if you recognize what this one is from. And it might help if I highlight a couple of letters here. EDTA. And you might recognize EDTA, which is a lubricant used to dissolve inorganic material in endodontics during pulp therapy. So if you got that correct, give yourself an extra credit bonus point. And that leaves PAA, or polyacrylic acid, which is the most common acid used in glass ionomer formulations. So the answer here is D. Question 10. Smooth surface caries refers to which of the following? Go ahead, pause the video, and then we'll go over this one together. So smooth surface caries can occur on any of the axial surfaces of the tooth, so facial, lingual, mesial, distal. And don't overthink this one. It's where there are no pits and fissures and where the tooth is generally smooth surfaced. So facial, lingual, mesial, and distal are all smooth axial surfaces of the tooth. The occlusal surface, with all of its pits and grooves and fossa and whatnot, are certainly bumpy and not smooth surfaces. So D, that includes both B and C, is going to be the most correct answer of these. So the answer here is D. All right, which of the following is not a reason why fluoride prevents tooth decay? Go ahead, pause the video, and then we'll go over this one together. So in our first video in the series, we talked about how fluoride does several things to help prevent tooth decay. Number one, it remineralizes the tooth by driving that reaction to the left, as we looked at in that first Le Chatelier's reaction in the series. So it also not only remineralizes it, but it also strengthens the tooth, converting that carbonate substituted hydroxyapatite to fluorapatite, which has a lower critical pH, making the tooth more resistant to acid demineralization. So C and D are certainly very useful things that fluoride does to help our teeth. Now, it also interferes with the metabolic activity of cariogenic bacteria because it is an antimicrobial. So it does do A as well. It does not, however, prevent the bacterial aggregation process during plaque formation and maturation, because even if we have fluoride that bathes our teeth, plaque is still going to form until we brush it off. So the answer here is B. Question number 12. How many blades does a finishing burr have compared with a cutting burr? Go ahead, pause the video, and then we'll talk about this one together. So the more blades that you have in a carbide burr, the less tooth structure each of those blades is digging into the tooth. So more blades equals a smoother cut. So the number of blades absolutely is related to the burr type. So we can certainly rule out D, and there's a difference between those two, so it can't be the same number of blades. So it has to be either A or C. And as we talked about, the more blades you have, the less tooth structure they're each going to be removing. So a finishing burr is going to have more blades than a cutting burr because we want a smoother finishing type of cut. So specifically, the average cutting burr will have 6 blades, the average finishing burr will have 12 blades, and if you get even a smoother cut, you're going to have more and more blades. So the answer here is C. Question 13. Which of the following carbohydrates found in the human diet is most responsible for caries? Go ahead, pause the video, and then we'll talk about this one. So carbohydrates begin to be digested the minute they hit the mouth, thanks to amylase in saliva. But unfortunately for us, bacteria can also digest them. So let's rule out some incorrect answers. Cellulose and glycogen are complex polysaccharides that cannot be broken down in the mouth, and bacteria can't digest them either. So those are not going to be what we're looking for in this answer. Glucose and lactose are cariogenic, but not as much as some other sugars because these are just simple monosaccharides. Sucrose, however, is present in a lot of the foods that we eat, and it's a disaccharide of both glucose and fructose. And so it's broken down into glucans and fructans by bacteria, particularly that Streptococcus mutans, which ferments it into lactic acid, which helps to form caries. So the answer here is C. All right, so the first day of the board exam will be 400 questions with those operative dentistry-like questions, just like the ones we talked about, spread throughout that exam. On the second day, when you come back, you'll have 100 more questions that are case-based. So they'll give you information on a patient, maybe with some clinical photos, an exam sheet, and maybe some radiographs. But otherwise, the questions are very, very similar. So question number 14 and 15 in this video will be examples of questions pertaining to the same patient. So for question number 14, a patient reports sharp notches near the gums of her upper teeth, and we have a picture to show that. All the following reasons are likely to indicate the need for restoration of a cervical lesion except one, and which one is the exception? So go ahead, think through this question, and then we'll talk about the answer. Okay, so these notches she's talking about are these cervical, probably abfractive lesions along all of these teeth. So if the notched area is symptomatic, if it's either sensitive or causing them pain, that is absolutely an indication to restore them. So we can confidently rule out that answer choice. If there are aesthetic concerns and it bothers the patient, how they look, then that's certainly an indication for a tooth-colored filling in that spot. So I would say that's also an indication for the need for restoration. If it's a deep notch, likely the pulpal or the gingival tissues are in jeopardy because of it. So yes, that should be filled as well if it's deeply notched axially. And of course, if there are caries detected there, that's class 5 active decay that needs to be restored. So although cervical notches are seen more often in older patients, their age alone should not be a factor in the need for restoration. So the answer here is A. And lastly, during the radiographic exam for this patient, you notice thick radiopaque lines underneath some of the patient's posterior amalgam restorations. And that's what these arrows are pointing to. So what are they most likely? Go ahead, pause the video, and then we'll go over this last question together. All right, so this is a bit of a tricky one because it integrates concepts from both operative dentistry and radiology together. And the fact is, all of these things, all of these answer choices here can manifest as radiopaque lines. So we can't rule out any of the answers right away. And it's more based on how these lines appear. So they are little rectangles. You can see the edges and they form little tiny radiopaque rectangles. So a liner would appear like a very thin line along the floor of the prep, or at least by the part where the prep approaches closest to the pulp. And honestly, it would really only stand out if this was a composite restoration. The composite restoration wouldn't be quite as radiopaque, and the liner would be a little bit more radiopaque than that resin material. So it's not likely that this is any kind of liner or even base material. A metal artifact is something you would see on a cone beam CT image. There are these white streaks across the entire image, and that doesn't apply to a bite wing like we see here. So that's not the correct answer either. Excess amalgam could be true, but a better example of that is down here where we have extra overhang at the margin. And that could be very likely due to creep over time like we talked about before. So this one may be true, but not feeling too great about that answer choice. The amalgam restorations on tooth 14 here and tooth 19 have retentive pins, and that's what you see here, that enhance the resistance and retention form. Because look at how big these restorations are. Those teeth are very likely missing cusps and or vertical walls, and they're in need of that secondary resistance and retention form. So the correct answer for this question are those little retentive pins that go inside the dentin to help reinforce both resistance and retention. All right, so that's it for this video, guys, and this series. So thank you so much for tuning in and watching. I hope you learned a lot, and I hope these questions were helpful. Let me know how many questions you got right. I'm really curious to know how everybody's doing, so leave a comment below and let me know how many questions of the 15 you got correct. Please like this video if you enjoyed it and subscribe to this channel for much more on dentistry. If you're interested in supporting this channel and what I do here, please check out my Patreon page. A big thank you to Michael Raja, Reb Boyd, Ria Wadwa, Jonathan Muff, Eric DiMatteo, Alexa Klunder, Jonathan Wynn, David Jaden, Isabella Caldas, Ali Benshir, Badir Hefnawi, and all of my patrons out there for their support. We just hit 100 patrons at the time of recording this video, and I'm just so grateful for everybody who's supporting what I'm doing here, so I can't thank you enough. You can unlock extras like access to these video slides to take notes on as you watch them, and practice questions for the board exams where I go through more questions just like these and give explanations like I'm doing here. So go check that out if you want some additional resources. The link is in the description. Thanks again for watching, everyone, and I'll see you in the next video.